Testing, testing. 1, 2, 3. Hi, everyone. Please have a seat. Everyone, please take your seats. We're about to get started. Please enjoy your salads. Your dinner will be right out. We're serving dinner early on. Please have a seat.
Good evening, everyone, and welcome to the greatest city in the world, the city of Chicago. On behalf of the city, I am honored to welcome you to the annual Medglobal Conference and Gala. We are honored to host this convening of heroic physicians, medical relief teams, and humanitarian leaders. I want to recognize the leadership of Medglobal's founders, Dr. Zahir Salou.
Please have a seat, everyone. We're about to get started. Yeah, 9. Can you tell? Everyone, please have a seat. We're about to get started. Enjoy your salads. Dinner will be right out. We will be starting in 1 minute. Please have your seats. Yalla. It's 7:30. Let's look. I think I'm so close.
Yeah, just relax, smile.
Yeah. All right, everyone. We're about to get started. Can I have your attention? Tell them to close the door.
I did.
Yeah. Yes.
Okay, I think
Okay, people are seated. I think we're okay on the seat numbers. Good evening, everyone. Good evening, everyone. Please have a seat. We're about to get started. Please enjoy your salads. And please give your attention to the screens. We will begin momentarily.
Good evening, everyone, and welcome to the greatest city in the world, the city of Chicago. On behalf of the city, I am honored to welcome you to the annual Medglobal Conference and Gala. We are honored to host this convening of heroic physicians, medical relief teams, and humanitarian leaders. I want to recognize the leadership of Medglobal's founders, Dr. Zahir Salou and Dr. John Kaler, two proud Chicagoans who healed the world. From earthquakes in Turkey to war zones in Syria, Ukraine, and Gaza, these heroes and their teams deliver care and hope where it's needed most. And they don't stop overseas. Their presence is right here in Chicago's South Side, where they serve and uplift our communities. I hope this gala renews your spirits for your continued important work. And I hope you have the best time exploring Chicago during your visit. You will find that we are a city of strength, spirit, and a unique soul with something for everyone to enjoy. Thank you.
Why does Medglobal work every day to bring healthcare to a turbulent world? Because children suffer from malnutrition. Because no child should go to bed hungry, deteriorating from a problem we can prevent. Severe acute malnutrition weakens their bodies, stunts their growth, and steals their future. But with therapeutic nutrition, medical care, and support for families, malnutrition can be treated and lives can be saved. Because pregnant women need life-saving care. Because no mother should face childbirth in fear. With state-of-the-art portable ultrasound equipment, complications can be detected, lives can be protected, and families can welcome their babies with hope, because chronic illnesses can be managed, because diabetes, hypertension, and asthma don't disappear during war. Even when hospitals are bombed, families still need insulin, medicine, and care to live their daily lives with dignity. Because mental health in conflict zones is critical. Because trauma lingers long after the bombing stops. In Syria, Gaza, Ukraine, and Sudan, children and adults carry invisible wounds. Access to mental health care can restore resilience, hope, and healing. Because clean water prevents the spread of disease. Because safe water saves more lives than medicine ever could. In places where cholera and malnutrition are rising, clean water is the most basic form of health care. Because mobile medical clinics take health care to those who don't have access. Because in communities suffering from disasters and limited resources, healthcare must reach people where they are. A single mobile clinic can treat hundreds every day, improving access to sustainable, dignified healthcare through emergency response, health services delivery, and the building of resilient healthcare systems. Because training builds healthcare for tomorrow. Because when we train local doctors, nurses, and midwives, we leave behind knowledge that saves lives long after emergencies end. One training session today can mean thousands of lives saved tomorrow. Because new health facilities give patients a place to go. Because rebuilding hospitals, clinics, and maternity wards is not just about bricks and mortar. It's about giving people a safe place to turn when they need it most. Because healthcare is a human right. Because no one, no matter where they are born or what crisis they face, should be denied the right to care, to treatment, to life. Behind every number is a name. Behind every statistic is a story. Behind every patient is a life worth saving. That is why we are there.
Good evening, everyone, and welcome to the 5th annual Medglobal Gala. My name is Dr. Hannah Ibrahim, pediatrician, board member, and director of the Medglobal Conference and Gala. We've just wrapped up an incredible conference over the last 2 days, having very honest conversations about what's happening all over the world in places like Ukraine, Sudan, Gaza, and Syria. We didn't just talk about crises, we talked about courage. Doctors and midwives who have volunteered, who have worked with Medglobal to discuss what they witnessed firsthand and the stories of resilience, strength, and hope. And over the years, it is due to all of you. All of you in this room have fueled this change. All of you are the reason why Medglobal exists. You are the reason that we grew from reaching 200,000 people in our first year to reaching now over 39 million people. You are the reason we can create creative programs like our family-friendly clinics in remote areas of Yemen, where we have creatively thought about equipping a room in a midwife's home and turning them into mini clinics with medical equipment for only $1,000. And because of that, women who never had access to prenatal care now receive regular checkups, and in our first 100 days, there have been 0 maternal deaths. You are the reason why Medglobal runs the 3rd largest nutrition center in Gaza. You are the reason why healthcare has become a form of peace building in Syria, where communities once divided by conflict are now beginning to heal as Medglobal brings health services to everyone without distinction. You are the reason why we can train frontline health workers in Ukraine and give them specialized skills during a war that has lasted far too long. So tonight I begin by thanking you all being here today. This evening is about hope, inspiration during this difficult time that we live in. We have some very special guests here today, and I wanted to mention them. Ambassador Michael Murphy, Ambassador to the Order of Malta in the African Union, Honorable Nada Draz, Consul General of Egypt, Gina Stefanos, Deputy Consul General of Egypt, Dr. Huzaifa, Dr. Fateh, Mr. Barak from the Turkish Consul General, Mr. Jonathan Gamboa, Vice Consul General of Colombia, and Mayor Greg Hart from Hinsdale. Finally, this weekend would not be possible if it wasn't for our sponsors, BASMA, the Judy and Peter Kovler Foundation, Kiam Institute, Stellar Foundation, CMMA, Prime Healthcare, MCI, Modern Skin Dermatology, Hayat Home Medical Equipment, GMD Surfaces, Almaz Salon and Spa, and Nayat. So with that said, let's get started. I would like to invite our MC for tonight, a comedian, a storyteller, and an attorney. She literally told me she's an attorney by day, 9 to 5, and then she does all the other things at night. Born in Egypt, raised in Alabama. Yes, that you heard that right, raised in Alabama. She's toured internationally, performed on Netflix and NBC, has her own show on the Hulu network. She is a passionate advocate for refugee and women's rights and the perfect person to be with us tonight. Please welcome Yasmin El-Hadi.
Hello. Good evening, everyone. And Assalamu alaikum. How many non-Muslims do we have in the room? Let me hear you. That sounds sad. I'm going to ask one more time. If you are not Muslim in the room, I want to hear you. Shalom. Love it. Okay. So happy you're here. If you're Muslim in the room, can you make some noise? I like those odds. Those are good odds. I'm so happy to be here. I'm so excited to be emceeing tonight. My name is Yasmin. When I heard about the mission of Medglobal, I got excited about it because you do the kind of work that, honestly, lots of other people simply cannot access and cannot do. And you do it with such passion and such sincerity that sometimes even people lose their lives doing this work. It is so special and so selfless. Also, if there are single doctors in the room, call me. It's also why I did it. I'm just joking. That was a joke. You don't want to laugh? That's fine. It's okay. The only reason you're probably not laughing is that you're not a single doctor. You're like a married doctor or perhaps a nurse or nurse practitioner or a pharmacist or an activist. I'm really, really excited to be here too because we're in Chicago, one of the best cities in the entire world. Yeah. Our MC, Dr. Henna, talked about a guy named Barak from Turkey, and I really thought it was Barack Obama. I'm actually kind of disappointed. They told me that Barack Obama was going to be here because this is his town, but they lied. I'm really excited to be here too because my children aren't here, so that's good. Alhamdulillah. How many of you have children? See how tired you sounded? You sounded so tired. If you're single and you don't have kids, I want to hear you. You guys kind of sound lame too. What's going on? You guys do a matrimonial thing with Medglobal? No? Just checking. A little bit? next time, kind of. That's kind of my thing. I'm half Egyptian, half Libyan. I was born to an Egyptian mother and a Libyan father, and I was born in Cairo. And then my dad, he was like a tiny, teeny bit in the Gaddafi regime, like a smidge, like a little bit. Kind of, you're like, that's spicy. What is that cumin? No, it's dictatorship. And you might be tasting it now. It's not a good flavor. It blows the palate. But my dad, he morally abstained against Gaddafi, so don't worry. I said I was a refugee, an asylum seeker, and he actually moved our family 6 countries to get to the freedom and safety of these United States. I know, right? America. Nobody wants to clap for America? Come on, it's America. It's amazing. It's amazing. It's amazing to be here. And then my parents took us to a place that was neither safe nor free, and that was Alabama. Alabama is where I grew up. It makes no sense. I talk like a white woman from Connecticut because that's who taught me English as a second language. So thank you, Miss Mooney. I appreciate you. The kids were like, why do you sound funny? You sound weird. Why do you talk like that? And I'm like, I don't know, literate? I have no idea. This is just what a Yankee did. I love the fact that my dad has this past because now he's like so dedicated to democracy. He's so dedicated to ethics, which is why he beat us as children, but ethically. How many of you were beat as children? That's a lot of therapy in the room that is needed. Okay, well, I'm the 6th of 6 kids, so by the time they got to me, they just got tired. They were like, please, raise yourself. We're so exhausted. And then that's why I do comedy, because I was not beat enough. Thank you. Thank you for laughing at that. So I'm just doing a little quick joke set here. I know you guys are annoyed by me. It's good. Who wants jokes while you're eating? Says no one, right? No one ever. Thank you, white guy. I appreciate you. Oh man, do I got to be nice to him because he's white? I don't know. He's right in the front. He's really triggering for me, to be honest. Oh, you want me to be louder? Oh God, that's annoying. Okay, I'm gonna do one quick joke. My mom is the most judgmental human being I've ever met in my entire life. Can anyone else relate? I have an Egyptian mom. Anyone here have an Egyptian mom? Syrians are worse. This is someone Syrian who said that, not me. Don't get mad at me. Don't come for me. But my mom was so judgmental that every single time that she didn't like something, she made this sound, which is, I'm going to translate that for you because that's Arabic. And that means you're not good enough. And some Pakistanis have it too. It looks like this. It's fine, beta. It's fine. But it's not fine, and it never will be. White people don't know what I'm talking about because your parents loved you or left you completely alone to do whatever you want and drink at the age of 11. It was really cute. One time I got a concussion. It was because of my mom, and it was because I said shh to her. That was the one time she actually made contact with me. I was 12 years old. I told her to shh, which when my white friends heard it, they were like, it's so good that you told her your thoughts. It's so important that you express yourself. That's not how we work. There was no expression. I was slapped very hard, and now I'm a better person. I'm a better person for it. That was the one time she ever hit me. So when we first came to the United States, the first people we encountered as refugees were actually the Catholic Church. It was nuns. And I remember these nuns took care of me. They literally washed my feet. They put socks on me. They were so humble, so beautiful. And I just remember looking at them and saying, wow, look at these women, full of service. They're no ego, the opposite of my mom. And yet they look exactly like her. So that's why I started wearing hijab. So that was good. So thank you for the habits, and thank you for all of the incredible interfaith allies that we have in the room, all the people here that are not Muslim that I forced to out in the earlier. Thank you for doing that. It means a lot to me. I really appreciate that you're here. And there's always time for you to convert. So I'll be taking your conversions later. White guy. Later. Okay, sounds good. All right. So now I want to just set the stage because I'm going to talk a little bit about me being a refugee later because it is a very specific experience. And a lot of the work that Medglobal does is with people who are internally displaced within their own countries, but also with refugees. So we'll come back to that. And I want to just now introduce the man behind the hour, a physician, a humanitarian, a man who really does not need much introduction. And he is someone who has been on more than 50 medical missions. He is the president and co-founder of Medglobal. Please put your hands together for Dr. Zahir Sahlul.
Good evening. Thank you, Yasmin, for opening the night with these sarcastic jokes. I laughed at some of them. So it gives me great honor to welcome all of you to our annual gala. And I'm really amazed by the diversity of this crowd. So you can look at your right and left and enjoy the scenery. This is not something that we see it in our galas, but this is how the world looks like. So I would like you to take a moment and look at the table around you and make a connection with someone that you do not know. Just eye contact for now. Let us thank the conference and hardworking teams led by our co-chair, Dr. Hina Ibrahim, and the gala team led by my wife, Suzanne, for the extraordinary work they went through during the past 5 months to make this happen. Let's give them a round of applause. And please stand up if you are a board member or staff member of Medglobal. Stand up if you are a board member, or you can stay standing up. Stay up. And please stand up if you have volunteered with Medglobal. Stand up if you have volunteered with Medglobal at any capacity. And please stand up if you partnered with Medglobal. If you're partnered with Medglobal, better you volunteered, you can stand up. You volunteered, better. And please stand up if you donated to Medglobal. If you donated to Medglobal, please stand up. All right. Well, God bless you. This is our family. Thank you for all of your generosity and leadership. And so this is our celebration. So I would like you to focus a little bit about the words that I'm going to be conveying. This is very important. That's why you're here. And I am honored to be among you. You are the heart and the soul of Medglobal. And thank you for being here and for all of your sacrifices. We just concluded our 5th annual conference. We had more than 30 panels and 130 speakers. We talked about issues that are complex and difficult. We had heroes who came back from Gaza, from Sudan, from Ukraine, from Syria, from other parts of the world, who risk their life so they can provide health care to the people who are suffering. I heard nothing but good feedback from the people who attended the conference. Today, Dr. Mufaddal, I said, did you have good experience in the conference? He raised his hand. He said, this is my 4th conference. And you had the best conference food I've eaten. So that speaks for the good experience that people had. We had, what inspired me actually more than anything, that we had a lot of young people. We had high school students, college students, medical residents, and medical students who attended Medglobal for the 1st and 2nd and 3rd time. And as I told them that sometimes you need a spark to start a career in humanitarian work. And I hope that some of you had this spark today by what they have heard in the conference and connected with inspiring people. What unites us is a noble mission. What unites us is a noble mission to improve access to dignified health care to the most vulnerable. We believe in a radical idea. We're all a group of radicals, that access to dignified health care is a universal human right. We believe that a child, a pregnant woman, a trauma victim, an elderly person with heart disease or cancer, a traumatized healthcare worker, in the west side of Chicago, in Palestine, in Ukraine, in Syria, in Sudan, in Bangladesh, in Mexico, in Colombia, are equal in the eyes of God Almighty. They deserve our equal attention and equal resources. Now stand up if you believe in the same mission. So Yasmin, I made your task very easy. Okay, when you asked for money, everyone stood up. Now, in the next few minutes, let me talk you through our journey. As they say in Arabic, good beginning makes good ending. Good beginning makes good ending. إذا صلحت البدايات صلحت النهايات. 8 years ago, on September of 2017, I had the privilege to join a small group of physicians from Chicago in our first medical mission to the biblical city of Ma'rib in Yemen. Yemen was in the middle of civil war that claimed the lives of tens of thousands. We had an adventurous car ride from the city of Sayoun in Hadramaut in the west of Yemen to the city of Ma'rib in the middle of Yemen, 7 hours car drive. Our Yemeni driver was racing at 120 miles per hour. His right hand was clenched on AK-47 rifle, while his left hand gripped tightly on the steering wheel. His pupils were wide open, and his right cheek ballooned with cot, a powerful stimulant that is chewed in Yemen to keep people alert. By the way, Yemen has a much more powerful secret than coffee. If you're interested, I'm talking about the Yemeni wisdom. I asked him to slow down. He said, I cannot. We need to evade the heat-seeking missiles. Near me was Dr. Noor Al-Akhras. She is a pediatrician from Chicago. She also was 1 month pregnant at that time, but she took the leap of faith. She wanted to join our first medical mission to Yemen in the middle of war. I felt very guilty. That I invited her to such risky mission. In Ma'rib, we delivered a dozen of large bags full of medical supplies, treated patients with chronic diseases and children with malnutrition, and got to know our hosts and local authorities. We also experienced the generosity of the Yemeni people. Now fast 8 years forward, and we just celebrated our 8 years anniversary. Medglobal is one of the largest healthcare NGOs in Yemen, working closely with the Ministry of Health. We established primary health centers, mobile clinics, training programs for Yemeni doctors, nurses, and midwives, supported hospitals, established many COVID-19 programs, built oxygen generators, introduced portable ultrasound to the country of Yemen for the first time, sent dozens of medical and surgical missions, donated worth of $10 million of medical supplies, medical equipment, and life-saving medications. And recently we established, as Dr. Ibrahim mentioned, an innovative program, a woman-friendly clinic. Pregnant women in Yemeni villages must travel long distance to be checked, and sometimes they die after delivery or if they develop complications. So we never left the people of Yemen after the first mission, and we will continue to be in Yemen for the foreseen future. Our journey over the past 8 years took us to the refugee camp of Katapalong in eastern Bangladesh, where you have more than 750,000 Rohingya refugees crowded in small areas in Cox's Bazar, where we established one of our first refugee clinics. We supported in Bangladesh hospitals. We supported the host community. We established training programs. We established primary health centers, mental health and training programs, and cross-border relief in Syria for the internally displaced people in one of the worst wars in the 21st century. We established migrant clinics in response to the migrant crisis in Colombia. We responded to the wars and disasters in Ukraine and Sudan and Gaza and many other countries. We responded to earthquakes, floods, and hurricanes. We were one of the first organizations that built oxygen generators in India, in Syria, in Darfur, in Yemen in response to the COVID-19 pandemic, where people were dying because of lack of oxygen. We established mental health programs to treat the victims of wars, detention, torture, and also refugees who are traumatized by displacement. And we became an essential partner of a coalition called Every Pregnancy, a global campaign to reduce death and complications related to pregnancy and births. In 8 short years, we brought health programs to 27 countries, impacting the lives of 39 million people. It is a miracle by any definition. In Gaza, we deployed the first medical mission 6 years ago to train Palestinian doctors in Al-Shifa Hospital and Nasser Hospital on the use of portable ultrasound, a device that you can connect to your smartphone or your iPad, and your smartphone becomes a Doppler screen. And you can put the probe on the belly or the chest or the heart of the patient so you can make a decision at the bedside, even without access to electricity or MRIs or CT scan, and you can make a decision that will be the difference between life and death to your patient. We sent dozen missions and donated many devices. Each one of them costs $3,000 for those who want to donate for these devices, life-saving devices, to many hospitals. We also trained nurses, sent tons of medical supplies, and became one of the most impactful NGOs in Gaza. During my last medical mission in Gaza last year during the war, I noticed that every emergency room doctor is using portable ultrasound. Imagine the tens of thousands of lives that were saved by a technology and training that we have done years before this war. This is what we do to build resiliency in local community. We don't wait until the storm, we prepare communities before the storm. This is called building resilience, so they can weather the storm. We partnered with local communities, became an essential part of the health and nutrition clusters that are organized by the United Nations, and collaborated with many local and international NGOs. Our local team, 300 strong, is all local Palestinians, doctors and nurses. They serve their communities, they set priorities, create solutions, and hold us accountable. Right, Raja? This is called localization. Someone asked me at our first annual conference, what really distinguishes you from other NGOs like MSF? And this is what distinguishes us from other NGOs. That will start from the field, from the local communities, and they set the priorities, they hold us accountable, they become part of the decision making, and we support them. Medglobal is one of the few NGOs that embody localization. This last year, our 16 medical points and nutrition centers in Gaza served 350,000 persons. From the north to the south, we spent $16 million and provided 500,000 healthcare and nutritional services. 1 out of 6 Palestinians in Gaza benefited from our programs last year alone because of your donation and your support. According to the United Nations, Medglobal is number 2 NGO in Gaza in terms of nutritional support and number 3 in terms of healthcare support. And let me recognize our dear Raja Musleh, who oversaw our programs as they have evolved, if you can stand up, from the beginning. Thank you, Raja, for being with us and for your leadership. And also, if you are a volunteer who volunteered with us in Gaza, please stand up. If you have volunteered with Medglobal or any other organization in Gaza, please stand up. Those are the courageous people who not only provided health care in much need and stood with their colleagues in Gaza, but they came back and advocated on behalf of the people who are suffering. Let's give them a loud round of applause. Our programs in the field are complemented by a smart humanitarian advocacy. Or where's John? Advocacy. What should I, is that the right pronunciation? Okay. We speak out on what we have witnessed so we can win the hearts and minds. Our amazing doctors, like Dr. Firouz Sidwa, who will be the keynote speaker, and nurses like Lana, the nurse, can you stand up? Testified in the Congress, in the United Nations, and provided powerful eyewitnesses in the media, to their communities, in their networks, and also on TikTok. We want people to pay attention. Some people are not paying attention despite what's happening in these distant areas. And I always believe that what's happening over there will affect us over here. But we have to pay attention. So we wanted to make sure that the people are paying attention and our policymakers to change policies. One of the wise men long time ago told me, if you have the title doctor or nurse before your name, people listen to you, including your senator and your president and your secretary of state. So please, our doctors and nurses, use your voice and use your pen. It is powerful. We just published a very timely report about the impact of war and siege on Gaza, on the children in Gaza and pregnant women, called Starved by Siege. It showed 2,000% increase in the rate of acute malnutrition, which is a medical emergency. Up to 50% of children who have acute malnutrition may die because of infection or organ failure. 2,000% increase in acute global malnutrition in Gaza since the beginning of the war. Numbers do not lie. Data does not lie. And when you show this report to your congressman or your senator, they will be convinced and they will not believe the propaganda. We made sure that every member of the Congress received a copy of this indisputable report. I encourage all of you to read it. It's on our website, and share it. Where's our advocacy director, Anna Moran? She's here somewhere. Can you stand up? All right, so you can connect with her. Anna, thank you for all of your work and your advocacy on behalf of the population we serve. In Sudan, the silent crisis, our teams are among the few lifelines left. We provide with our partners, SAPA, healthcare, nutrition, and clean water to this displaced population in the north, in Khartoum, in Darfur. In Ukraine, we are helping with our partners to strengthen a healthcare system shattered by relentless attacks. We trained more than 5,000 Ukrainian doctors and nurses and medics and donated millions of dollars of medical supply. In Syria, after 14 years of war, our team created a beacon of hope in just 10 months. We launched Syria Healthcare Recovery Initiative, mobilizing a diaspora of 800 physicians, expanding our primary health programs, supporting the Ministry of Health, partnering with the United Nations and many NGOs, sending critical missions and launching a 3 million campaign in Homs, Aleppo, Idlib, Deir ez-Zor, the Northeast, Rif Dimashq, and Sueda. We renovated hospitals, trained new doctors, medical students, and residents. We also established the first center for the treatment of torture in the Middle East. The center was established by Dr. Ahmad Radwan and Dr. Steve Wine. Can you stand up? It provides comprehensive behavioral programs. It includes social workers, psychologists, and psychiatrists who are trained by the University of Illinois, and they will get certificate after 2 years. So far, they have provided treatment for 300 released prisoners from the infamous Sidnaya prison and completed 1,200 behavioral sessions. And I saw the prisoners, some of them in my last visit to Chicago, and I also saw their neighbors. and their psychologists, and they told me they have noticed significant improvement in their behavior, in the way they dress, the way they interact, the way they talk, the way they deal with their family. They became integral part of the society after long years of torture and darkness. Let's give Dr. Ahmed Radwan and Dr. Steve Wine a round of applause. And let me end with this story. I have a habit. You're the person who's paying more attention. What's your name? Alia, and you're Tala. Tala, yeah. Sometimes you're not. So Alia and Tala. So let me tell you this story, Alia and Tala, and everyone else. I have a habit when I go to medical missions, and I ask children, what would you like to be when you become in the future? And I ask this question to every child I met in Gaza. The children don't lie. And Tala, what do you think the answer of the children in Gaza when I ask them, what would you like to be in the future? Your sister can help you. She said doctor, and that's true. Every child in Gaza told me that they want to be a doctor in the future, in the middle of this war. So children, and by the way, Gaza has one of the highest literacy rates in the whole Arab world, right? Many people, young people, have multiple licenses and educated in medicine and IT, and because there is no job, so they have to be educated in multiple things so they can find a job. And also, Gaza is very diverse. By the way, Gaza exports flowers and strawberries to Europe before the war. And it's quite diverse. I mean, sometimes we think Gaza is one city. It's multiple cities, and you can travel from the north to the south, and you can see the diversity in the culture and the face of the people, and the slang and the cuisine also. So every child answered the same question with the same answer, except for one child. So I met this child in a school called Al-Fadila School. It's a school in Rafah. By the way, Rafah is now completely destroyed. But at that time, our mission was in Rafah. We stayed in Rafah. He was 12 years old. His name is Abdullah, and he was standing near the wall. And the city had about 5,000 people. In every classroom, there were about 40 to 50 people. They were displaced from the north to the south. And I asked Abdullah, what would you like to be in the future? And he said, what future? And he said, what future? That questions keep us sleepless at night and keep us also busy. This work, by the way, the work of Medglobal is hard, is heavy, but we do not carry this weight and burden alone. I am always inspired by the smiles of children in the tents or near their ruined homes while they're playing in the midst of disaster, and the persistence of healthcare workers who want to insist to provide healthcare to their community, even though that they are themselves displaced, even though that their family members have been killed or detained, even though that their hospitals are bombed and some of them have been detained themselves and tortured. That persistence keeps us working and keep us going. I am inspired also by all of you. This week, I attended the CHEST conference. I'm pulmonary and critical care specialist, so I do medicine also. A doctor I've never met came to me and he said, I know you from social media. You don't know me. I'm the director of program in Austin, Texas. And he said, I tell my fellow to follow you. I tell my fellow to follow you. I follow your work closely. You don't notice. But I tell people that he's the doctor who walks the talk. I was humbled to hear that. I don't deserve this, but I believe that you all deserve it, those, especially the ones who were into mission. That moment when he told me that, it made my day. I was very depressed because we had a lot of fights in an organization that I'm familiar with. That moment was not about me. It was about the doctors and the nurses on the front line who are doing God's work. I invite you all to join us in our fulfilling journey. Be generous tonight and become a mid-globalist. Together, we can create a better future, a better world for the child who lost everything except hope. Thank you.
As Syria entered its post-conflict phase, its healthcare system was left shattered, hospitals destroyed, doctors displaced, and families without care. But amid the rubble, hope began to take root again. Medglobal launched the Syria Health Recovery Initiative 2025, working hand in hand with the Ministry of Health, the UN, and diaspora doctors to rebuild the nation's healthcare system. Through 6 primary healthcare centers in Idlib and Aleppo, Medglobal has provided over 311,000 free health services, reaching more than 134,000 people. Reproductive care, pediatric consultations, non-communicable disease treatment, and safe deliveries, all restored where it was once lost. Nutrition programs have reached 58,000 people, and health education sessions have empowered tens of thousands more. At Al-Rahma Hospital in Idlib, over 55,000 people received essential and emergency services. And in Aleppo, through the Al-Rai Hospital, more than 5,600 dialysis sessions were delivered. Life-saving care for those with chronic illness. Mental health support became part of healing. Medglobal provided over 800 psychosocial sessions, including care for torture survivors and children with autism in Idlib and Homs. In Ras Al Ain and Tel Abyad, Medglobal's immunization program now protects a population of 300,000, including 9,000 infants, through 6 EPI centers. Across Homs and Deir ez-Zor, Medglobal established new stroke units, supported ICU rehabilitation, and led a nationwide dialysis campaign. 140 dialysis machines procured, 84 delivered to 8 governorates. Over 1,000 Syrian medical professionals have been trained in specialty and residency programs, online learning, and surgical missions, rebuilding a new generation of healthcare workers. From emergency response to recovery, from shattered hospitals to thriving clinics, Syria's health system is being reborn. We are focused on rebuilding a better future, because recovery is not just about restoring what was lost. It's about creating something stronger, more resilient, and more equitable. Together with our partners and communities, Medglobal is not only healing the wounds of war, but laying the foundation for a healthier Syria, one where every child, mother, and family has access to the care they deserve. Medglobal, rebuilding health, restoring hope, reimagining the future. Syria entered its post-conflict phase, its healthcare system was left shattered, hospitals destroyed.
Okay. That's not working. Okay.
This war has become an attack on children and healthcare.
100% of the population is in danger.
Dr. Michael Falk, a New York trauma specialist with the charity Medglobal, is working at a hospital in southern Gaza.
Dr. Feroz Sidwa is a trauma surgeon volunteering in Khan Yunis, Gaza with Medglobal.
The UN has warned that Gaza's healthcare system is now on the brink of collapse.
People are displaced and traveling along the roads.
For 2.5 weeks, Dr. Syed Saeed worked from early in the morning until late at night in a devastated Gaza.
American-Ukrainian trauma surgeon who works with the Medglobal group in Ukraine.
White phosphorus, chemical warfare, injuries that you see with drone warfare, different than what we had seen historically.
12 million internally displaced people in Sudan.
They're doing the same job that I was doing, with the exception of when they're on a scene, another missile might come.
From the Turkish-Syrian border, I've been speaking to Anas Barber from the humanitarian relief organization Medglobal.
The main hospitals in Khan Yunis area in mid-Gaza are at 300% capacity.
Doctors from the Chicago-based humanitarian organization Medglobal say the aid coming in is not near enough.
Basically, people are fighting
for food, and they are dying for it. You literally can see the aid queued up on the borders, and 100% of people are affected.
I'm here with Medglobal. Even though I was able to get in, half of my own group was denied entry.
Your report said, without urgent intervention, Gaza's malnutrition crisis will be followed by spiraling mass death.
This is famine, by definition.
Famine. For the first time, they say that it is a famine.
I'm not here as a policymaker or a politician. I'm a physician, bearing witness to the deliberate destruction of a healthcare system and the erasure of a people.
What you think of when you see those awful images of kids that are skin and bones, that's what we're now seeing more and more of. Starved by Siege, that is the name of a new report about the sharp increase of childhood malnutrition in Gaza.
I've never seen that extreme levels of malnutrition in all my 25 years of humanitarian aid.
The hospital is quite literally rocking back and forth most of the time.
They will do the double tap, where they will bomb a situation, wait a few minutes and allow rescuers to go in, and then bomb it again to really drive the message home.
Chicago-based Dr. Olga Myhudiak is currently in Ukraine working on humanitarian efforts with Medglobal. The organization educates Ukrainian doctors and nurses and operates mobile clinics on the front lines. As air raid sirens filled the air in Lviv, Ukraine, many fled or hunkered down, but Jones got to work.
I was working at the European Gaza Hospital. It has a capacity of about 250 beds. Now has over 1,000 patients.
Dr. Gallagher arrived at the beginning of the month and has been at Nasser Hospital with Medglobal.
Our emergency room is seeing anywhere from 200 to 400 patients a day.
All of these patients are getting shot, getting aid, looking for food.
We are seeing single shots to the head, neck, chest. My partners down in the emergency room have reported to me that 2 days ago, they lost 6 children.
Mr. Whitcock, just come here right now. In fact, I'll meet you in the deconflicted area outside of the hospital.
I don't know what else to say. I mean, the pictures are there every single solitary night. The need for a ceasefire is mandatory.
200 eulogies every day. 80 of them are for children. This has to stop.
God. Could you... There it goes. Hello. It's me again with the finger guns. Oh, God. Please take that down. Please take that down. Okay. I'm so excited to be here to raise money for this incredible work that you just all saw that Medglobal is behind. Can we just give a big round of applause to the physicians and the nurses and the admin staff, the IT professionals, the people doing logistics? This is an incredible feat. Just the immigration papers alone, the visas alone are going to be crazy on this project. So I just want to say it's really humbling because the doctor that we saw on there testifying before the UN is sitting at my table. Can you give him a round of applause? That's the guy that was in front of the UN. Incredible. I didn't see any of the Ukrainian physicians, but you know, this double tap is crazy, what they just described in Ukraine, which is an attempt to really destroy the aid workers and the people who are going there for life-saving purposes. So I want to first thank you for your attention. I know it's hard to hear, but this is really important for you to listen. So if you're chatting with your person, with your friend, just give me 20 minutes of your undivided attention. I still see some women chattering. I'm just kidding. It's the guys. It's definitely the men. This guy, I'm scared of him. He just told me to shut up. I told you, sir, you're very triggering. Okay. I just need literally, how about 15 minutes? I'll take 15 minutes of your undivided attention. Okay. I told you that I was a refugee in this country, okay? Coming to this country for the first time, it is, I can't explain what it means to like restart your life until you've actually had to restart your life. There are people that you're seeing on the screens and in the work that Medglobal does in Yemen or that they do in Sudan or the Ukraine. They're having to restart their lives, oftentimes within their own countries. And when we first came to the United States, it was like there was no plan. There was no savings plan. There was no college plan. I was my parents' retirement plan. I am still my parents' retirement plan. Okay? They're like, Allah will provide through you. I'm like, okay. Allah means God. Anyways. And I remember when I was in Alabama, I was trying to get out of Alabama for obvious reasons. And I remember I took every AP class I could take. So I took 14 APs so that I could get a scholarship to get out of there. Alhamdulillah, I got a full scholarship to go off to Emory. And thank you. Oh, wow, you're listening to my story. Thank you. When I went off to school, I wanted to study everything because it was a very big deal that I went off to school. So I studied a Bachelor of Arts and a Bachelor of Science. Now, what they don't tell you when they give you a full ride scholarship is they don't cover your books. And the books were $3,000 a semester. So I ended up getting 2 jobs to cover my books. In 2004, a man came to our school by the name of Siraj Wahaj. He came to our school, and in a room full of students, half this size, he told everyone in that room that they were going to give and that they would not leave the room without giving. Now, I was trying to not make eye contact with him. I was there for the free food. I was trying to get a pizza. I was poor. And he said, everyone in here is going to give. And I'm thinking, he can't mean me. I'm sitting in the right corner. I just won't look at him. I'll just dissolve into my chair and become a puddle. He said, everyone in here is going to give until it hurts a little bit. I was like, well, I'm in a lot of pain. Oh my God. He said, everyone in here is going to give until they're broken. I just was broke. He said, I want your fear to be broken. I want your ego to be broken. I want this idea in your mind that you're not going to be replaced with something better to be broken. Every whisper that you hear, you've got to break out of that, because what I'm talking about is not always rational. I'm talking about something spiritual. I'm talking about something cosmic. I'm talking about matters of the heart. And I'm thinking, I got to get out of this room. There is no way he's talking to me. He made everyone in that room give $1,000. I want you to understand that I was at that point maybe 19. I had just turned 19. I had never seen $1,000 in my life. Seriously, I didn't even know what president was on the $1,000 bill. It's confusing to me. Now, my mom, she had been judgmental, alhamdulillah, and she told me that my hijab had holes in it, so she had given me a $100 bill that weekend. And I remember I had Mr. Benjamin in my pocket, burning a hole in my pocket. She said, please, you're embarrassing, fix yourself, is what she said. She's like, you're going to college, you have to come back with husband. I'm like, all right, I'll work on it. So I had a $100 bill in my pocket, and in that room, he told us that everyone is going to give $1,000 and that they had to give big, and that was how the entire universe was going to shift in your favor when you did something difficult for someone else, especially when it was hard, especially when your back was up against the wall. He said, this is the time to give. And I'm like, he can't. Oh my God, is he talking to me? When I tell you I was the last person in that room to put up my hand, I thought a ghost raised my hand. I was in the right corner where those 2 women are talking right now, disrespectfully. They don't even know that I'm talking to them because they're talking. 2 wear hijab, 2 not hijab. SubhanAllah, both the same. Hello, ladies. Yes, I'm talking to you. So I was the last person I can do that because I wear hijab. I'm a woman. You cannot do that, sir. You don't do that. So I remember I raised my hand and I thought, how in the world am I going to ever pay this $1,000? And he said, everyone is going to give from the thing that they love the most. You love money? You love money. You have to give from the thing that you love. The Quran says in verse 92 of Surah Al-Imran, in chapter 3, that you will never achieve righteousness until you give of what you love, what you adore, what you are clutching. Many of you in here have Teslas and you need to make tawbah. Many of you here have Teslas and you need to ask for forgiveness. from the American people. You love that Tesla. You love your Model X. You love your Model Y. I want to ask you why you still have one. You're not taking it with you to the grave. It's not going to fit. We're all going to the same place, guys. And when I tell you that I was thinking, okay, how do I do this? How in the world am I going to make $1,000 actually donated? I can barely survive. I went to my bank. It was a SunTrust Bank on Emory's campus, and I go, hey man, how much money do I have in the bank? He's like, $77.20. I'm like, that's not a lot. Okay, how much does it need to survive? How much can I take and there's still an account in my name? He said $20. I'm like, okay, let me take out 50. I left $20, and 22 cents. And I remember taking the money out, and I said, oh God, this $100 bill, I love it so much, but it can't go with me. I'm not taking the $100 with me. So I put the $50 with the $100 that was in my pocket, and I put it down as my first payment towards the $1,000 pledge that I made. That same week, on Friday, this was a Tuesday, on Friday, I got an email from the Emory Bursar's office. They said, hey, your GPA is over a 3.9. The Good C. Ree White Scholarship will cover your books. And in that moment, I was like, God is real. This is not magic. It's not voodoo, if you will. And if you're not Muslim right now, it's easy to become one. But even if you're not, bald guy, there is something about the law of attraction that is true. Oprah, The Secret, Brene Brown, yoga, whatever you want to call it. The universe will reward you when you do good. Energy out is energy in. So if I'm doing good and I'm trying to manifest, we'll call it manifestation. Muslims have it as dua. Okay, we ask God for something, and I have a positive view of God, which means I believe that the universe is always conspiring in my favor, not against me. That's called husn al-dhanna billah in Islam. That's right, Islam had all the answers. It did. I don't know what to tell you. It did. But if you believe in the manifestation principles, it says that you will draw the good towards you when you put the good out. And you will draw negativity towards you when you hold on to what you have and clench your fist tight. So after that moment, I applied to every major scholarship because I was trying to go to grad school. I was trying to go to law school or get my master's. I applied and I was a finalist for the Truman, the Rhodes, the Marshall, the Soros. I lost every single scholarship when it came to the interview round. It's because I'm gorgeous. This was 2004, 2005. Do you guys remember the War on Terror? We're back at it. It was impossible to win one of these scholarships. Always a bridesmaid, never a bride. And I remember thinking, okay, Allah, your move. Your move, God. Your move, universe. I'm going to give as much as I can. The last donation that I made was $150. They were two big bookends. It took me a year and a half to fulfill my $1,000 pledge. 1 year and a half, I picked up a third job on the weekends. God is my witness. And I remember putting the last $150 down. That same day, I got a phone call. They said, is this Yasmin Al-Hadi? I was like, it is. If you're white, who is this? They said, this is the American University in Cairo. We've been trying to get a hold of you. We're really excited about what your professors have put forward for you. We'd love to give you a fellowship. I was like, my professors? Unbeknownst to me, my professors had actually turned in my work to the American University in Cairo for a graduate fellowship. They said, it's a fully paid for grad fellowship so that you can go and study at the American University in Cairo. And I went. I was like, okay, God, I guess this is real. When I went there, I got a dream. Who did I see? Siraj Wahaj, white on white. He said, you're not giving until it hurts. You're not giving until you're broken. And I'm like, what do you mean? I'm a broke grad student. He said, no, you have to give. Give and you will be replaced in ways that you can't fully imagine. So I remember waking up that morning, I got into my metro to go to Tahrir Square, to go to the American University in Cairo, the original campus. And there was a little girl who looked at me, she said, I really like your necklace. I was like, okay, this is it. This is the sign. I took off my gold necklace, I gave it to her. The end of that week, I get an email from the UCLA School of Law. I only applied to 4 law schools, all that had Islamic programs associated because I thought maybe I could keep going and get my PhD. And they said, we've been trying to get a hold of you, but we think that you're in Cairo to do your resume, doing some type of Islamic something, some Arabic something. We'd love to give you a full merit scholarship to go to school. I got a full ride to UCLA. Then I get the same dream, Isra al-Hajj again. I'm like, really, bro? Again? He's like, you need to give more. You're sitting on your laurels. I don't like that. You need to be really kind of broken. Stop sitting, and the blessing that you have will testify either for you or against you. Let it be a testimony for you. Let it testify for you and not against you. Every single one of you in here, by the way, is in this room by invitation. It didn't happen on accident. The universe conspired for you to be here, sitting in this room, and I hope that you are blessed beyond your imagination today. I remember I ended up having to sell something at that time, and I gave it away. And then I got a phone call from John Templeton from Princeton University. He said, we love your application. We're going to give you a full merit scholarship to go do your master's at Princeton. When I tell you that my $1,000 donation turned into an over $450,000 ROI, I'm not lying. God as my witness, the $1,000 was multiplied in ways that I cannot fully have fathomed. There's some of you in here that can give at a very high level, and there's some of you that cannot give at a very high level. I'm challenging you, for those of you who can give a lot, to give more than you expected today. Perhaps so much more that your vacation is at peril. You may have to refinance your home. That's what I did in 2020. I ended up refinancing my home because, I'm not just talking the talk, I'm walking the walk. In 2020, when I had a job that was secure and everyone was in the pandemic, the throes of the pandemic, I said, I have to give 30%. I have to give 30% of my earnings away. I can live on 2/3. I need to give 1/3 away. And I did. And that's honestly the whole story of how I even got on TV and have a show on TV. All of that is because of that one critical move that I made. And yes, I had to refinance my home. It was the best move I could have made. Later, I realized that I had locked in a 2.62% interest rate. Pretty damn good. Pretty damn good. Thanks, God, universe, all of it. Thank you. Some of you cannot give very much, and I'm challenging you today to give in a way that maybe you had not expected. Even the little ones, even the little guys, okay? Even the little ones can come together with their soccer teams, with their local schools. They can sell candy, they can sell lemonade, they can rake. The things that I used to do as a kid to make the money. So I'm challenging you too to give until it hurts today. Okay. I don't know, some of you probably have problems that cannot be solved, but there is someone who can solve them. There is something that can solve it. Every single one of you has sicknesses in this room, both known and unknown, and there is something and someone that can cure it. Every one of you in here has an issue that you've been asking for. You've been asking for so diligently, and it hasn't come to fruition. And I'm asking you tonight to think about the way to move the needle forward for you, because you're moving the needle forward for someone else. You are giving, and by being in a giving state, nothing but good will come for you. Nothing but good will change for you, and you will be blessed in ways that you cannot fully fathom tonight. I promise you. There was a woman in the audience. I do this all over across the country. There was a woman in the audience. She was 39 years old. She had never been married before. She wanted a baby. She said, I'm going to give $12,000 today. I said, that's $1,000 a month. She's like, yeah, I'm going to do it. It was difficult for her. She sends me photographs. She says, I found a man and he was hot. I'm just saying. He was tall, he was good looking. PhD. And she's sending me pictures. She's being married at the Kaaba. She did her katb kitab in front of Allah. He invited her to his home. One of many homes. One of many homes, the houses of God, all of our houses of worship, places of goodness, places where those nuns took me in when no one else would take us in. When we were pariah, we were Libyans, we were pariah anywhere we went. The first number I'm going to ask for you is a big number. It's $100,000. There is someone already in the room who's committed to this. I'm looking for someone else to maybe pair with them. Maybe you can match somebody in this effort. That's about $8,333 a month. That's less than $10,000 a month. Some of you are making more than that on your commercial real estate. Some of you are making more than that in your businesses or in your startups. Yes. Do I got one? Takbir. Say Allahu Akbar with me, which is just a call to prayer. It means God is the greatest. Thank you, sir. So someone already gave 100,000, he will match at 100,000. Beautiful. Does anyone want to join this brother and be the third to give? Anyone else at 100,000, which is $8,333 a month? Okay, we'll move on to the next number. With $48,000, you could build 5 medical centers serving 7,500 patients. You heard Dr. Sahlud, he said that they have now reached 39 million people by your donations. You can treat 480 children suffering from severe acute malnutrition and provide 8 maternal health packages with ultrasounds and trained staff, especially on that mobile ultrasound. $48,000 is just $4,000 a month. Some of you can afford this. Thank you. Takbir. 1, 2, 3, 4. Okay, Richie Rich. Okay, rich girls. I see you. MashaAllah. Do I have a 5th? Because God is prime and he loves prime numbers. Do I have a 5th? I have a 5th. Takbir. Say Allahu Akbar with me. We have a woman named Nancy Lenachek, and she has given $66,236.57. Incredible. Thank you, Nancy. Okay, the Ajram Family Foundation has given $100,000. Takbir. Allahu Akbar. Okay, guys, we're going to move, I think, to our next number. Our next number is at the $36,000 level, and it's coming. Whenever you would like. I need the slide to change. Hello. Hello. Thank you. Okay, at $36,000, that is $3,000 a month. You can support 3 to 4 medical centers serving up to 6,000 patients. Treat 360 children. That's a child a day for almost a year. Incredible. Just for $3,000 a month. And you can provide 6 maternal health packages with ultrasounds and trained staff. Do I have someone in here that is willing to give at the $36,000? I see you. Takbir. I see him in the corner right there. That's 1. Do I have a second? Do I have a second with this gentleman? Where are the women at? Come on, ladies. We have these 2 beautiful girls in the front. Anyone else at $36,000? We have the Thaddeus Plant, who gave $40,000. Give him a big round of applause. He beat my 36. Do I have anyone else that's willing to give at $36,000, which is just $3,000 a month for the year? Anyone else? Okay. All right. Can we do a little prayer for you guys? A non-denominational prayer? Okay. Oh, universe, Lord, God, whatever you believe in, we ask for you to make the giving easy today. We ask for you to make this giving a source of blessing and mercy for the people receiving it. We ask for it to be a source of blessing and mercy for those giving. We ask for it to be a source of illumination well beyond the people's death, and a legacy that will continue to give. We ask for it to be considered a continuous charity. We ask for it to be a companion for people in the darkness. We ask for the illness that people may have to be cured. We ask for any sins or any misgivings or any mistakes that they've made to be forgiven. We ask for the things that they need the most, maybe they're embarrassed to ask for in the deepest recesses of their heart. We ask for you to give it to them. We ask for you to meet their needs. We ask for you to be gentle with them and to give them dignity in their life and dignity in their death and to protect their children and to give their children a beautiful path of servitude and real service to all of humanity, to not just one group or one color or one ethnicity, but all of humanity. Say amen with me. Did you guys see the thermometer? Okay. So I want to just be clear, the QR code that is on your table is the easiest way to give. I know some of you want to Zelle and PayPal and all this crypto. That's illegal, but not these days. Anywho, if you want to give through these ways, I just want to explain that there's an administrative cost that is associated. So it's much better for you to donate directly to the organization, please, using your QR code. Okay, I'm going to go back to my levels now because I know some of you are thinking, can I give at that level? Okay. Can we go to the next level, which is $24,000? At $24,000, that's just $2,000 a month. You can support 2 medical centers serving 3,000 patients, 240 children serving from acute malnutrition, and provide 4 maternal health packages with those mobile ultrasounds and staff. Do I have people in the room that are willing to give at this level at the $24,000? Well, thank you. 2 men. 1, 2, takbir. Thank you, sister. 3. Thank you, sister. I have 3. Do I have 2 more people that can join them at this level, at $24,000? Do I have 2 more people that can give at $2,000 a month? Anyone else that was willing to join them? Okay. I have one, Hudson Berry. He is a board member. He gave $30,000 to Ukraine. I have a gentleman named Azam Muftah. He gave $25,000. I have Dr. Luke Tamais. He's the head of the Ukrainian Medical Association North America, $25,000. I have Maher Fatouh. He gave $25,000. Do I have anyone else that's willing to give and join these gentlemen and ladies at $24,000? Anyone else at $24,000, which is $2,000 a month? Anyone in the room? Anyone at all? I have here Assam Attasi, $24,000. We give sirran wa alaniyan. We give in private and we give in public. We give in both ways. So I'm sure there are people who are giving anonymously as well. All right. I think we have finished. Everyone at 24,000 will go to our next level, which is, I call it the miraculous level. This is $6,000. It's just $500 a month. $500 a month, something that you would not even be able to get a rent for. Instead of renting a room, rent perhaps a part of heaven, whatever you want, for $6,000. And here you will support essential healthcare for 180 patients and treat 120 children. Oh, look how we're almost at $1 million. Just, are you seeing this? Are you seeing this? Are you seeing this? It's incredible. There are many of you that can give at the $6,000 level. Many of you. It's just $500 a month. I'll start now to ask and see. Thank you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, thanks, scary white guy, 18, 'Do you have anyone else at the 6,000? Thank you. 19, 20. Thank you, sir. 21, 22. And Conrad Fisher at $6,000. Thank you, Conrad. Give a big round of applause to Conrad. You could pray for hair. There's still time. I remember when I was praying for a husband, I wasn't like specific enough. Astaghfirullah. I love that. Okay, Conrad. Astaghfirullah for you having a husband. All right. And I'm astaghfirullah for me having a husband. So I remember I prayed for a husband, but I wasn't specific about the height or the hair. I'm going to do better next time. So I want, whatever you're doing, whatever you're giving today, make a very specific prayer, okay? Ask the universe something very specific that you want, because it will work. I have here a gentleman by the name of, I think a gentleman, Tabriz Ahmed. He gave at 13,500. Double the 6,000. Oh, wow. I have a family, Abdul Hamid Halabi, $48,000. Amazing, amazing. Ammar Aqais, $100,000. Okay, we're almost at $1 million. We're almost at $1 million. Does anyone want to join at the $6,000 level that has not joined at $500 a month? Anyone else at $600 a month at 6,000? Sorry, $500 a month at 6,000. Anyone else? Anyone else want to get on this train? I think someone's clapping because yes. Choo choo, it's the blessings train. Stop near you. Get on the platform. Conrad even danced with me. That was good. That's haram. You say astaghfirullah, brother. Thanks, buddy. Okay, I have Fida As-Sufi gave $17,810.24. That's very specific. Okay. Maher Khan gave 15 grand. Kindi Academy, 15 grand. Let's keep it going. David Klassen, 15 grand. Ismail Basha, 15 grand. Islamic Foundation, that sounds very suspicious, 12 grand. Muhammad Sheikha, okay, he probably comes from a line of scholar ladies, $10,384.53. Anisa Muthanna, board member, $10,341. Where are they getting these numbers? It's insane. Sam gave $10,000 as a board member. Yahya Basha pledged 10 grand. Khaldoon Sheikha and Lulu, please announce anonymous. Oh. $10,000. Okay. Muhammad Nasser Sabagh, 6 grand. I'm sorry. I'm so sorry. Vima Real Estate, right under the $6,000 mark. They wanted to give $5,694. Thank you so much, Vima Real Estate. But also spring for the rest of it. Can we get 303? Come on, guys, $300. Get over it. You guys want your real estate business to grow? Then work on this. Okay. Haq Nawaz Khan, 5 grand. Dr. Lena Shabender, $12,000. She wanted to give $1,000 a month. She won that miracle. Marzia Faruqi, 5 grand. Nareen Nazar, 5 grand. Orland Park Prayer Center. I love that. 5 grand. What kind of prayer is going on in there? I like it. Okay. Sheker Family Foundation. I want to be part of this family. $5,000. And Dr. Mazen Al-Asadi, excuse me, for $4,500, $4,500. Okay, we're going to keep going. Bashar Ericososi. Is that an Italian name? 50 grand, $50,000. So yeah, it's Italian, baby. We all Italian tonight. Ericososi. Ericososi is a spicy meatball. Okay, that was racist. That was racist. And you should not record that. Mahmoud Sayed gave $48,000. Allahu Akbar. Can you guys just say, for the non-Muslims in the room, I'm going to tell you to repeat something after me. It just means that you support Medglobal. It's La ilaha illallah Muhammad Rasul. Go ahead, Conrad. Muhammad Rasulullah. Atif Rafiq, $24,000. You guys are beautiful. Can we give a big round of applause to everyone who's given so far? Oh my God. You make me love you. I wanted to hate you, but I love you. Okay, I'm almost done. I'm almost out of here. What, you don't want me to leave? Okay, we did it. Okay. $1.4 million. Sayed Khan, thank you for your 6 grand, my guy. Insania Relief. They're insane in the membrane. $3,500. Naveed Ansari, $3,000. Stephen Wayne. Thank you, Stephen Wayne. What an interesting way you spell your name. $2,500. Aziz Ansari, not the comedian. $2,000. Dr. Milton Strauss. Dr. Milton Strauss gave $2,000. Thank you, sir. He sounds like a third or a fourth. Taha Suglatwallah. Okay, $2,000. Thank you. What a fun name. Tariq Malhans. This guy is half white, half Arabi. Okay, $2,000. Malhans. And Dr. Muhammad Al-Azam, $1,500. You guys are amazing. You guys are amazing. Thank you. Okay, this is it. We're just rounding out the end here. At $3,000, you know, you can actually help 350 patients through the clinic visits. Again, that's almost helping a patient a day. And $3,000, because I'm not good at math, I'm an attorney, is $250 a month. Just $250 a month. I hope that the room blows up. One, in a good way. Not, I said blow up, but you know, light up is what I meant to say. God, I got a little too confident up here. Okay, anyone else at $3,000? Enjoy Isra Shaka. Thank you. 2, sister. At 3,000. 3, thank you, white guy. I think you're white. I like you. 4, yes. 5, 6, thank you, sis. Thank you, Henna. 7, I see you, brother. I see you in the back, Pakistani gentleman. 8 in the beautiful green, I see you. 8, thank you, sis. 9 with the white lady. Hey, white girl. 9. Hey, white. What'd you say? Is she with the Arab guy? You stole one of our guys? I love it. That's 9. Anyone else? Anyone else want to rob? 10. Rob us of Muslims. 11. Thank you, white lady, because you were the white man. I like this pairing. This is a good pairing. Okay, you stay right there. You're too pretty. Too pretty. She was lucky number 11. Do I have someone else at $250 a month that will join in the blessing of tonight, in the barakah of tonight? Barakah train, choo-choo, coming through. Anyone else? Anyone else? $3,000 at $250 a month? Okay, I believe we stopped at 11. Do we have 2 more? I think we can squeeze 2 more. I got Merzia Faruqi at $5,000. Mashallah. Noreen Nazar, $5,000. Mashallah. Najar Dental, $5,000. Mashallah. Sana Bengali, okay, her name tells you what she is, 5,000. That was great. That was great. I love Bangla people. I have Dr. Muhammad Marghari at $36,000. Come on, give it up for him. And then we had Atif Rafiq from before at $24,000. Thank you so much. Okay, guys, this is the last and final level. This is a Siraj al-Hajj number. We should be lit up like a Christmas tree. Like a Christmas tree. At $1,200, that is $100 a month. You will serve 180 patients and 12 children, and you can actually have follow-up care for 5 mothers. Who in here can give at the $1,200 level if you have not already given? At $1,200, we should all be lit up, which is just $100 a month. Thank you. 1, 2, 3, 4. Thank you, sis. 5. Thank you, brother in the bow tie. That's a nice bow tie, my guy. Come on. Nobody doing bow ties these days. You out here. You out here. That's 5. Who else at $1,200? Thank you, sis. 6. Thank you, 7. 8. 9. Thank you, Khala. Thank you. 10 and 11? Is this a married couple? It's so cute. The couples who give together stay together, okay? Love you. I love that they have separate bank accounts. That's healthy. That's healthy. Okay. That was 11. Anyone else that has not given, that is willing to give at the $100 a month level? Oh, I see you. 12. I see you. Thank you for the light. This is a really big room. Anyone else? Anyone else want to just join in the blessing? $100 a month is like it's like your Starbucks money that you're going to save because you're not going there ever again. Or I'll find you. My son outside the Starbucks in the airport, he's like, no, genocide, no, lattes. I'm like, you can't say that. Anyone else? Anyone else? Okay, I'm going to make a collective prayer for everybody. You guys ready? Here we go. Oh Allah. Oh God. Okay, so we kind of crushed it. Okay, that's an all-time favorite for me. I've raised about $10 million before this. I raised $12 million. We have Medglobal from Asim and Mariam Khan, $10,000. God bless you. God bless you. I have another person at that 12,000, Zahir Sahlu. Zahir Sahlu, Dr. Sahlu. I'm gonna rip this up. He doesn't mean this. God bless him. Can we give it a bit? This is the founder just gave it 12 grand. What is happening? I almost don't want to accept it, sir. MashaAllah. Radwa Rajab at $6,000 and Sobia Sadiq at $9,000. What a beautiful number. Okay, guys, we're gonna make. Is this enough, or we're going to talk some more about what other people have given? Here we go. These to announce them. Zayd Abdus Sattar. Just kidding. Zayd. I don't know why I called him that. Zayd. His name is Zayd. Zayd Abdus Sattar, $6,000. I almost forgot I spoke Arabic. Okay. Layan Rahmani, $6,000. Muhammad Al-Akhshar. Al-Akhshar. Not Akhdar. Akhshar. Okay, $6,000. Imran Siddiqui, $6 grand. Sharik Ibrahim, $5 grand. And then we have this person here, Malaz Al-Attasi. This family has given a lot of money, mashallah, $6,000. Takbir. Say Allahu Akbar with me. Okay. All right, guys. I'm past my time. So I just want to take a moment here, and I want to pray for everybody. Oh Allah, oh God, oh universe, and all of the energies that connect the earth and make so that our lives feel like they have meaning. We ask for you to imbue those who have given with a sense of purpose. We ask for you to help those who have given to give and to give more and to teach your children to give. We ask you, oh Lord, to please help those who have given to be removed of any ailments, to remove any obstacles from their path, to give them light in the darkness, to help them have hope when there is no hope left, to remember their purpose and to remember their direction is always in service. Oh God, we ask for you to please illuminate the graves of all those who have given well beyond their days, well beyond their living days, to make them a source of light and a beacon of light for every community they enter. We ask for you, oh Lord, to please remove the difficulty and the ailments from those who are suffering in Ukraine, Gaza, Sudan, Yemen, and all over the world, in countries that we sometimes forget. We ask for you to help us remember them and to remove their suffering and their ailments and to help us be a source of goodness for them. And for our wealth to be a testifying for us and a testimony for us, not to testify against us or a testimony against us. Let us give of the things that we love and attain righteousness. Let us be of the people who are truly prophetic. We walk the walk and talk the talk. The Prophet ﷺ, the Prophet, may peace and blessings be upon him. And we ask for God to send his peace and blessing upon the Prophet and upon his companions and his family. The Prophet, he was called As-Sadiq Al-Amin. He was called As-Sadiq Al-Amin. He was called As-Sadiq Al-Amin because he told the truth and he was trustworthy. And they went hand in hand. And when you tell the truth, this is why your sadaqah, charity, is from sidq. It's from your truth. So those who are true, who are sincere human beings, they give. That is their truth. That is your testimony, is what you give. And he was called Al-Amin because anything you gave him, he returned in a better state. We hope that the money that God has given us and entrusted us comes back to us in a better state by giving and offering a change, a positive change, a transformation in someone else's life. We also ask, oh God, to make us a people of security, of amn. It's the same triliteral root in Arabic, amana. Al-Amin, the one who is trustworthy, we are his amana, we are entrusted to him. But also, it also means that you felt al-aman. You felt al-aman with someone with prophetic character, because that means that they walk the walk and talk the talk. They don't lie. They tell the truth. They're straightforward. So you feel totally secure with them. I ask that all of us become a canopy of truth and security for the people around us. I ask for us to be a people who live by truth, and we protect people in safety, and that they feel like they can be in their truth around us and not in judgment. Anything that I have said today, it is from me and my silliness. And I ask for your forgiveness if I offended you in any way. I respect your religion. I love your religion, and I love you, and I love your cultures. And I love that we can sit in this room and do this in this great country. We have to protect this country. This is our country. It's ours. Thank you. I do have some people that want to be named. Mr. Greg Shea at $1,000. Thank you, Greg. You're the best. Miss Marwa Ali, thank you so much for your beautiful donation of $100 a month at $1,200. And Miss Carolyn Jacobson, thank you so much for your $100 monthly donation. Every bit counts. Yes, honey. The QR codes are not working. We have the Square, and we can charge with the cards. And whoever needs to use Square, let the volunteers know. Thank you so much for your time. I really love you all. Thank you. Oh, yes. I'm supposed to introduce this wonderful man. Forgive me. Forgive me, because I'm 15 minutes behind schedule. Okay. So now I want to introduce someone who's extremely important, Imam Hassan Ali. He is going to give us a rundown of all the sponsors and the newest partnerships between HCI, and Medglobal. Thank you. Give him a big round of applause.
Thank you very much. This is amazing. Please give a great hand to Sister Yasmin for her great performance tonight. Thank you very much, Yasmin. So I believe tonight we are here to celebrate the power of being together. You know, great things are always made even greater when we do it together. When we pray together, we strengthen our faith and our unity. When we stand together, we become a powerful force for change. When we talk together, we share wisdom and insight that inspire. When we eat together, we build bonds of trust and friendship. And when we heal together, we create a healthier, more compassionate world. The Quran teaches us that the believers are but brothers, and that the hand of God is always with the hand of the group. And the Bible reminds us that two are better than one because they have a good return for their labor. These timeless teachings remind us that our partnerships are the cornerstone of our success. And so this is by itself is a great testimony of applying and fulfilling this divine call to come together as one family, as human beings. We all have the same last name, Adam. And so we are here to confirm that we are going to fix this world all together. Let me remind everybody about these great facts and announce some great surprises tonight. Thank God, by itself, the numbers are great and amazing. But we have also some other surprises. We have, through our work and partnership with other organizations, we have from the United Mission Relief, UMR, and Brother Saleh is here with us. He's the CEO. We have $250,000 of partnership. Give them a hand, please. From Helping Hand for Relief, we have another $250,000 of partnership. Give them a hand, please. From the Girls Relief Worldwide, Brother Faisal is here from Canada. I think he left earlier today. But we have another $200,000. Please give him a hand, please. Okay, the QR code is working now. So give the QR code and the IT people a hand, please. From the Chicago Muslim Medical Alliance, or the CMMA, Dr. Tajamul Hussein is here with us. $200,000 from partnership. Give them a hand, please. Another $100,000 from Muslim Aid USA. Give them a hand, please. And a very special organization, as all of our special organizations, From the Human Concern International, HCI, we have the regional program director here, and Dr. Raja Musleh also here, who serve now with them as country director in Gaza. We have $1.5 million of partnership. This is amazing. This is the value of partnership. My role in Medglobal is the director of community engagement and partnership, and I'll be very happy to schedule a personal time with you to have maybe nice biryani, nihari, steak whatever. It has to be halal for me, but you can eat whatever you want to eat. And we can talk together about potential partnership so we can serve the humanity all together. So I would like to thank all of our partners. Their dedication and support amplify our impact, and together we are making a difference in this world. Thank you all from the bottom of our heart. You made the night for all of the people in need in Gaza, in Syria, in Lebanon, in Sudan, in Yemen, in Bangladesh, in Ukraine, in Colombia, in Mexico, and everywhere in the world. The tomorrow will be better because of all of you. Thank you, all of you.
Another announcement. Thank you so much. Give it up for this guy, Imam Hassan Ali. I'm sorry I did not introduce him properly, but he is Medglobal's Community Engagement and Partnerships Director. We have another donation that came in for $3,000 from Alia Natafari. Natafari? Say it again. Natafji. Okay. Arabiya. Okay. Kamran and Usra Chaudhry just gave $10,000. Thank you so much, his family. You guys are the best. I love you guys. We did it. How much? What? Is that right? 5 million. Allahu Akbar. That's amazing. I want to cry. That's amazing. That's amazing. That's amazing. You're very beautiful. I want to. I want to apologize if we're running a little bit behind. We're about 15 minutes behind schedule, so I'll try to rush through this. But the keynote speaker is someone extremely important. That's Dr. Feroz Sidwa. Dr. Feroz is a general and trauma surgeon who's volunteered in Gaza, the West Bank, Ukraine, Haiti, and Zimbabwe. He is known for his extensive humanitarian work in conflict zones like Ukraine and Gaza. He holds degrees from Johns Hopkins, Harvard School of Public Health, and has authored articles for publications such as the New York Times and Politico. He was the one who testified before the UN. His recent volunteer work in Gaza has been particularly highlighted, where he has described harrowing conditions in hospitals. I almost did not recognize him from on TV to today. I mean, look, he's so sad. Okay, he's a really good man. Please join me in welcoming Dr. Sidwa. You look so sad in that photo.
Thank you. I hate when they play that UN video because it shows that I only own one suit. It's very embarrassing. Anyway, the title of this conference was "Health in a Turbulent World." In 1990, there's a Swedish novelist named Henning Mankell. He was observing atrocities committed by the South African apartheid regime in northern Mozambique. He was walking towards a village that had been burned by the US-backed anti-communist forces when he saw, as he said in his words, "I saw something I shall never forget as long as I live." A young man walked toward me, barely wearing a rag, and he had painted shoes onto his feet. He had no boots, no shoes, nothing, not even a pair of sandals made from the remains of a car tire. So he painted a pair of shoes onto his feet. And in doing so, he boosted his awareness that despite all his misery and destitution, he was still a human being with dignity. Scenes of violence and deprivation like that can evoke sometimes painful memories from people like me and many of you who have witnessed such scenes themselves. In Gaza, when I was working with Medglobal, I had a 16-year-old patient named Ibrahim. He was one of the last people I took care of on March 18th when the widespread bombing of Gaza resumed. On that day, I gave him a colostomy, and he recovered well. And by March 23rd, he was ready to go home. It was late. It was after iftar, and I said, well, just discharge him tomorrow. So I said, I'll go down to his room and just make sure his bandages are okay, just make sure his family understands that he's going to go home tomorrow, what that means. And on my way down the stairs from the 4th floor to the 2nd floor, his room exploded. The Israelis fired a drone-fired missile, killing him and the other man in his room. And my only solace is that he probably died instantly in the blast. I eventually made my way down to the emergency room and found his body was brought down at the same time. And when I pulled the sheet off of him in the trauma bay, I recognized it was him immediately. His abdomen had been torn open, his colostomy had been ripped apart, and sure enough, he was dead. The first person that I found, actually the first person I found that could live that day, was on March 18th, was a young 5-year-old girl named Sham. She had a brain injury. There was a shrapnel injury to her left cheek, as well as an injury to her lung and her abdomen. So I took her to the operating room, fixed her abdomen, fixed her lung. But there wasn't anything we could do about the brain injury. Now, we did a CT scan, and the shrapnel had stayed on the left side of her brain, and so it was a survivable injury, and kids are pretty good at healing, so she did. And a few days later, we were able to take the breathing tube out of her, but we were worried she would never speak again. That's the left side of your brain is the dominant side that has language and other such things. Well, she started moving the right side of her body. That's a good sign. And then maybe 5 or 6 days after she was extubated, she looked at her mom in Arabic, and she said, "Mommy, I want eggs and juice." And her mom jumped up out of her chair. She was so excited because her daughter was talking, and she thought she was never going to speak again. And she hugged her and she kissed her, and she said, "Sham, of course, you can have anything you like." And then she put Sham back in her bed, and then she collapsed on the floor crying because she knew there was no eggs and juice anywhere. And finally, another story, but this was from the first time I went to Gaza. I met a scrub tech, and on his phone, he had created a case. There was Scotch tape and just some black marker. So I asked him about it. I said, "Why do you have Scotch tape and black marker on your phone?" And he said when he was taken from Shifa Hospital by the Israeli military, he was relatively quickly, he and some other healthcare workers were let go. And the Israeli commander of the unit that had taken him, or that was imprisoning him, I don't really know, told his soldiers very explicitly that unlike most of the people who were arrested, they were not to destroy these Palestinian cell phones. He explicitly said these people were arrested incorrectly, just let them go. They didn't do anything. But the soldiers wanted to torment them. So they said, "Okay, we can't destroy their phones." They said, "Give us the cases on your phones." They smashed those, dropped their phones on the ground, and walked away. But in order to paint shoes on his feet in his way, he put his own case on his phone. Well, what does it say about us, that this is all happening? None of this was done in secret. I personally have had plenty of meetings with government officials under the Biden administration. I've written in the New York Times and in Politico, but it's hardly just me. Lana Abu Ghaib, Tammy Abu Ghanaim, Thayer Ahmad, Mark Perlmutter, Rajid Nabdi. There's tons of people all over the country saying these things all the time. It's hardly been done behind closed doors. And indeed, the majority of Americans are actually opposed to what we've been doing there. The majority of American society is. Well, Nicholas Luhmann, in his theory of society, he posits that society is just a kind of a positive feedback loop of communication. If that's true, then humanitarian work like what Medglobal does sort of extends society across the globe. It brings some of the most privileged people in the world, me and everybody else in this room, into a community with the most hunted people in the room, the people of Gaza, the people of Ukraine, of Sudan, of South Sudan. And it's just not possible to dehumanize people that you're in community with. That's not how it works. Well, genocidal violence across the globe and seemingly viciousness just seemingly for its own sake here, including in Chicago, is the opposite of what we in this room are trying to do. That those forces are trying to restrict community and society, and we're trying to extend it. And our society is going to have to decide, will we live in a place where the society extends across the globe and recognizes the sanctity of all human life? Or will we cut ourselves off from the rest of humankind, and in doing so from our own humanity itself? Medglobal, and more importantly, the people who make it up and make up any community like this, can help our society make the right choices in this regard. Zahir earlier said that someone had once told him that presidents, senators, and other political leaders listen to doctors and nurses. But as Lana, me, and a bunch of us have found out, that's not actually true. What we have learned, however, is that normal people do listen to us. And in fact, they find what we say to be credible, often fascinating, and that they do not, they can understand quite easily what our government is doing in the world and why the work that we in this room are doing is so vital. So it's our job not only to treat people in Gaza and not only to train healthcare workers in Ukraine, but to be that line of communication between the people whose will is ignored here and the people who are hunted there, to build a society in these turbulent times and hopefully to save humanity in the process. Thanks.
It's okay. Dr. Zahir Sahlul is now presenting Dr. Sidwa with his award, the Humanitarian Diaspora Award. Please join me in honoring him. Truly incredible. And I will now hand it over to Dr. Sahlul. He will now give the awards to the next attendees. I will say their names, okay? The first Medglobal Humanitarian Diaspora Award goes to the Ukrainian Congress Committee of America, Illinois chapter, Maria Dmitriev. Congratulations, Maria. Thank you. Thank you. Yes.
Dr. Souls says I should say a few words. I'm very humbled. I'm accepting on behalf of all the Ukrainian advocacy organizations, specifically my organization is the Ukrainian Congress Committee of America. I'm also with Ukrainian Medical Association of North America. I'm with all of you. And I'm a public health professional as well as physician. And we always do a humanitarian response. But the response to what? We have to think a step ahead next time because there's always a failure of diplomatic efforts when it comes to a humanitarian crisis. So advocacy, legislation, that's where all should put our efforts into. I'm sorry, it might sound harsh, but we have to kill the killer before killer kills us. Thank you all.
Thank you.
Thank you. I just want to say that I didn't talk about killing at all, and I got nothing to do with that. But you want to kill, you could kill if you wanted to kill. Okay. Yes, if you want to kill like in a legal way. Someone has lost their beautiful ring. It is looks like a green quartz and it's surrounded by diamonds, most likely white gold, could be platinum. I will not marry you like this. So if you want to marry me, you just have to ask, is yours, sir? Okay, well, sort of. You know it belongs to someone you know. Okay, beautiful. Are you going to ask her to marry you? Please do. It would be... Yes, that's an absolute yes. Beautiful. I saw you with your Catholic ring. I see you. I see you, my guy. Okay. He doesn't like me. Okay. The second Diaspora Award goes to the Syrian American Medical Society. Sam! They will all be coming up here to accept it. All these Syrians, get up here. We love you. I'm gonna get out of their way. Oh, they're rolling deep.
Of course, I'm part of the Syrian American Medical Society. I had the privilege to serve the organization during the rough time of the Syrian war, and I'm happy that the organization persisted after I left the organization, which speaks for what they call it level 5 system building of organizations. If the organization leaves after the founder or the leader of the organization, that means the system is built. And the people that you're seeing here are people who sacrificed their time, their skills, their money, and their life to build the organization, to provide health care to people who are displaced, to refugees, not only in Syria, but in many countries. And this is a model organization of diaspora organizations. We're proud of each one of you. We're proud of our organizations, the Syrian American Medical Society. Who will take this? Thank you so much.
Thank you so much, everyone. I would like to make sure that you know that Dr. Zahir Sahlul, he built SAMS before he built Medglobal. He was president of SAMS for 2 terms, and I was honored to be with him on the board more than 10 years ago. He is a graduate from SAMS, and mashallah, he did Medglobal to the whole world, making life-saving efforts in the whole world. Mashallah, Dr. Sahlul, we're so proud that me and him share many things. One of them that we are from the same city, from Syria, from Homs. We're neighbors, and he was my attending in my residency, and he trained me in residency, and he interviewed me for residency, and he took me. So we're very happy that SAMS continue to help in Syria after the civil war, after the war in Syria. Alhamdulillah, now SAMS, the focus is in Syria, helping in many programs, helping in building signature programs in all the cities of Syria, building programs in the most needed cities that ignored for many years by the old regime. And it's continued to focus in Syria and helping other organizations to build other countries, including Medglobal in Gaza. Inshallah, with more efforts to get work together. And SAMS is currently is a member of about 1,500 members of U.S. Syrian American members, and we are so proud that we got this honored with Dr. Sahlul to be awarded, and thank you so much.
بيض الوجه إن شاء الله دائما.
And to receive the humanitarian award is Adil El-Houni, Senior Consultant for the International Organization of Migration. Give it up.
IOM, of course, is one of the UN agencies, of the UN organizations, and we have a crisis of displacement. More than 130 million people are displaced nowadays in the world, and you are doing a great job addressing the refugees and the displaced. Thank you for all of your effort. And last but not least is a person that is dear to our hearts. She used to be a board member of Medglobal, and then she left us to establish an organization, a coalition that is helping pregnant women all over the world and to reduce mortality and morbidity related to pregnancy. Her name is Isra Shakir. That representing a coalition of every pregnancy that right now has 50 member organizations and raised millions of dollars to help pregnant women all over the world.
That's amazing. What up, Chicago? Come on, where's the energy? This is a full room. I expect people think Yasmin and I are sisters. Who here agrees with that? Right here. We're both from the DMV, the DC, Maryland, Virginia area. Who here was at the conference the past few years where I was the MC? Anyone here? Anyone remember me? Some of the first tables remember me. I am so honored, and I'm gonna get emotional, and I'm trying not to be here with you all, to see when we first started this conference in 2019, we did it at the Greek Museum downtown Chicago. We were like, let's bring people together who care about Medglobal and who would want to be advocates and champions for change. And let's see what we can do to raise funds together in a room in Chicago. We started off with 100 people in that room, 2019. The pandemic hit, Medglobal continued to soar and grow. And we decided as a community, obviously we weren't gonna meet in the pandemic. And in the first year out of the pandemic, we did it here, the conference. I was working in the NGO world for many years. My entire career has been in the advocacy campaigning space. I was at Amnesty International.
the ACLU National, Oxfam International, everywhere. And I saw, though, through my efforts in supporting Medglobal, an organization that really stood out to me, that had tremendous value in how it looked at human beings like me, with the identities that I carry in the parts of the world that I come from, in Syria, and cared about us as people, and wanted to invest in our resilience, in our courage, and in our hope. And I was inspired to be part of this whole journey with Medglobal for the past few years, and then as a board member, and then creating my own coalition under the Gates Foundation, the organization Every Pregnancy, where we have over 50 organizations that are serving on the front lines in over 20 countries, saving moms and babies' lives day in and day out. And Medglobal is one of our proud partners. We're so honored to be in our coalition. Together with our partners, including Medglobal, we've raised over $34 million for moms and babies' health in 2 years only, and we're only going to continue to grow. And we're so honored that we get to get grants and funding for the work that Medglobal does. But this, right here in this room, take a look around and see what we were imagining 5-6 years ago to where we are now, raising over $5 million. I'm blown away by all of your support, but truly by the leadership and the hard work of the entire Medglobal team, the board of directors, the staff across the world, and Dr. Zahir Sahloud right here, who deserves the biggest round of applause. I did not expect this award. I did not expect it, and I am so humbled and honored to receive it on behalf of the Every Pregnancy Coalition, the over 50 organizations that commit their lives day in and day out to the moms and babies of the world. Every pregnancy should be safe. Thank you all, everybody.
During the conference, we presented many awards to very distinguished people. And if we can put the slides for the people and the organization that received awards, I think I would love to recognize each one of them and let them speak here, but I know that we don't have time. Henna will kill me, and my wife also will kill me. But I'm going to recognize few names. But stand up if I mentioned your name. Dr. Radwan Rajoub and Ismail Basha, you came with your families from different states. Thank you very much for your leadership, for your philanthropy, for what you have done to the American, to adopted home and to your homeland in Syria. Thank you. May God bless you. And also, I'd like to introduce or recognize one of our stars in Medglobal. She's our communication director, Lina Sahlul. She's not related to me. Lina, where are you? Lina, thank you very much for your leadership, for your commitment. She does not sleep. She does not sleep. She came in all the way from Bahrain. I'd like also to recognize many of our partners, organization. We recognized this year Nove Ukraine, and I forgot how many other organizations. But if you can read the names here, it's amazing. These are amazing organizations and partners, amazing people. Each one of them deserve to be recognized today and speak, but we don't have time. So let's give them all a round of applause. And also, we lost last year 3 members of our staff in Gaza. They were killed with bombing. One of the panels that we had in the conference targeting healthcare workers, which is becoming an epidemic in every war. So we remember and we pray for their soul to be blessed. Faris Al-Abid, Ahmad Al-Kalhout, and Yusuf Labad. May God bless their souls. Thank you very much for everyone who donated, for every penny that you donated, for your attending the gala. I hope that you'll join us next year. We'll have 5,000 people. And enjoy your networking, enjoy the dinner, enjoy the diversity. May God bless you. Thank you.
We do have just, a couple more awards that I want to recognize. And I also just want to recognize that we've raised like over $2 million tonight in this room. And that was through the help of many people. Buthaina Jabir gave $25,000. Mitch Becks and Shannon Becks gave $10,000. Dr. Suleiman Bangash gave $10,000. And a great partner by the name of Besma that does a ton of work in Bangladesh gave $25,000. So join me in thanking them. I want to recognize that was the first group that he showed the awardees There's a second group for the Philanthropy Award, and that includes Tariq Chima, Radwan Rajoub, Anisa Muthana, Dr. Muhammad Ammar Ayas, Ambassador Michael Murphy, Fahim Korfan, Ismail Basha, and Yahya Basha. Give them a big round of applause. We also want to recognize our Homs Health Recovery Team. These are people who have volunteered to help rebuild the health infrastructure in the city of Homs after the liberation of Syria in December 2024. Give them a big round of applause. Ahmed Sibai, Abdullah Rafai, Mohammed Akhshar, Ahmed Radwan, Amir Zaini, Noor Nakrur, Badr Jandali, Dana Al-Khalid, Bana Attasi, Badr Husseini, Samir Wahoud, Malaz Attasi, Samih Saifu, Khulud Bajbouj, Amir Al-Khudri, Bilal Al-Hamwi, Bashar Rijawi, Asma Akhras, and Suzanne Akhras. Okay. And there was also a team that, just for the Gaza team, that did so much work in Gaza. And that includes Dr. Greg Shea, Dr. John Kaler, Dr. Chandra Hassan, Dr. Zahir Sahlud, Nurse Lena Abu Gharbiya, Dr. Saeed Saeed, Dr. Nimr Ikram, Dr. Tamadur Abu Ghanem, Dr. Vanita Gupta, Dr. Ahmed Yusuf, Irfan Galeria, Dr. Ahmed Ubaid. We know Irfan. It's our guy. Nurse Meryl Tidings, Dr. Yassine Peaks, Dr. Yuzur Khan, Nurse Sabrina Liang Das, Dr. Feroz Sidwa, who's sitting here, who just gave us a rousing speech, Dr. Thomas Adam Kiwais, I probably got it wrong, Dr. Michael Falk, Dr. Tipu Khan, and Dr. Kathleen Gallagher. Give them a big round of applause for the Gaza team. Finally, we want to recognize Nova Ukraine, Dr. Jeff Kramer, and we want to thank you for all the work that you did in the Ukraine. Yes, give him a big round of applause. Give him a big round of applause. Okay. So it's time now. There will be a recap video at the end. Ooh, thank you, videographer. So stick around for the recap video at the end. I want to just thank you all for the incredible night. It was kind of amazing. They said that we raised in the room just tonight $2.1 million. So give yourself a big round of applause. That's amazing. It was truly an honor to be your MC, and we're going to have some group photos. Dr. Henna will come back on stage for a group photo with the board staff volunteers to be recognized. We're going to listen to the music of Basil and the Supernaturals, and we'll have a recap video. Thank you all for a beautiful night. We love you. May miracles happen for you. As you are making miracles happen for other people, I hope miracles happen for you. I hope the mountains move for you. Thank you.
Gala is not only does it showcase the hard work that Medglobal does, but it also, most importantly, shows the impact of Medglobal.
It's not just a conference and a gala. You're bringing healthcare providers from all over the world to one spot to look for ways for us just to be better.
This is our 5th conference. The conference is a meeting of volunteers who've been in war areas and zones, who came from Sudan, from Ukraine, from Gaza, from Syria, so they can tell their stories.
Latin America, we are facing a huge wave of migration. I'm talking about families suffering.
In Gaza, the level of trauma you witness is something nobody would be prepared for.
You know, when you're in Ukraine and you see the people you're working with, you see the needs, you see the gratitude, it's life-changing.
That faith you give it to the people, that humanity has not forgotten them, that matters the most.
At its core, Medglobal is a humanitarian organization. We do need help in order to continue doing that good.
If you don't have the funds, you can't provide the equipment to the people in need. You can't provide that critical logistics they need.
Medglobal's core purpose, I think, is really just to express the best of humanity.